When your stem cells cannot divide fast enough because the decline in the capability of proliferation from age 60 versus when you were born is 400,000 times decline. So that is huge amount of decline in the regeneration.
Yeah. Hey friends, Dr. Yi-Song is here to challenge one of healthcare's most stubborn assumptions, that treating symptoms is the same thing as healing. Dr. Yi-Song, welcome to Nina's Notes.
I'm very happy to be here.
I'm happy to have you too. So you grew up with 17 generations of Chinese medicine in your family before you even went to medical school. I think that is so fascinating and so cool. So I really want to start there. What did medicine mean to you when you were growing up in a house with so much ancient wisdom there?
I actually grew up with both Western medicine and Chinese medicine, but of course my family root has 17 generations. So my grandparents, they were actually trained in Western medicine. And my aunt, who's my mother's older sister, she had a lot of health issues when she was growing up as a child. So when I was growing up with her, she actually introduced a lot of ancient Chinese treatments to me because she needed to find solutions for herself. She also studied with my great-grandfather, who was trained in Chinese medicine, and then my great-grandfather up, they were trained in Chinese medicine. Some of them were even imperial palace physicians to the emperor back in the Qing dynasty.
With your aunt was trying to treat something within herself, can you elaborate more on that story? What did she find and what worked for her, and how did she leverage I think you said your great uncle, right?
Yeah, so what happens is she was thrown from a donkey's back during the Civil War in China while she was being transported on the donkey's back, and she was only 2 years old back then. So because of that, she had some head injury, and at that time, there was not a lot of medical facilities to treat that. So my grandmother at that time just, sutured the opening in the head. But then after that, she always suffered headaches and a lot of digestive issues. And when she became adult, she also had a lot of gynecological problems. So that's when she actually started seeking a lot of traditional alternative Chinese medicine treatments because Western medicine couldn't treat her. She also studied with my great uncle and then actually my great grandfather. And then she also studied with a lot of other Chinese medicine masters in China because she was always trying to find out solutions for herself. And then she also treated people with leukemia and other different things in China since she studied with these masters. And then she also was very into doing meditation, having Qigong masters treating her. So she would have Qigong masters coming to our house to visit. So that's when at that time I was maybe around 12 years old. So that's when I was introduced to meditation, and I actually tried meditation myself when I was around that age, and I even got into a certain stage. So I do know I have the ability to achieve certain stage in meditation because I already felt that before.
That's incredible that you started your meditation practice so young. I feel like I just started mine 2 years ago. I try to meditate daily, and I feel like I'm starting to access these deeper levels of meditation. But to start so young, I mean, that's so incredible. And I'm sure in your practice, you encourage your clients to take on this sort of practice. Is that something that is a focus within you have a very holistic clinic in Boston?
So I have now tried to push people to do a lot of meditation. But of course, if they have a lot of stress, I will recommend them doing that. But I have not been really guiding them to do certain type of meditations. Like, what type of meditation you started doing? Are you just following the app, or are you following certain methodology?
Yeah, I don't have a certain methodology. I follow these guided meditations from Boho Beautiful Meditation that you can find on Spotify. I really enjoy them. And I don't know if they follow a particular practice.
Like some people, they say they do transcendental meditation, which is like they have particular methodology. And then also there are people who say they do certain Taoist meditation, so that's has certain lineage. But meditation is meditation, right? So I think most people, they don't know meditation is just sitting there not thinking about anything. You actually need to try to focus on your body's own energy flow. And also you need to try to isolate your body from any noise around your life. Then you can actually achieve into a certain stage that you feel your body is melted into the universe. That's all I can describe.
I definitely have not reached the body melting into the universe stage yet. Maybe a few
And
more years of practice.
according to the Qigong master who guided me back then when I was 12, he actually said a very small percentage of people, they could achieve a meditative stage that their soul actually leaves their flesh. So if you look at those monks meditating in the mountain, in the temple for months, not even moving, or even like, Buddha, Siddhartha, who started Buddhism, he was meditating under the tree. That's when he got enlightened, right? So that type of meditation, actually your soul does leave your flesh. So that's why when you have those Qigong masters showing you that they push their hand, then something moves very far away from them. So how could that happen? That's actually because their soul leaves the flesh, and then the soul travels in a light speed and then do those things for them. Well, this is very metaphysical. So
we are very metaphysical, and honestly, I am very deeply. I know you are also like you're a classically trained doctor. I am trained as a scientist, so I'm very grounded in the material world as well. But I am very curious about the metaphysical and these accounts that we can't exactly explain, and there's lots of ways to reach these altered states as well, with the help of psychedelics and meditation.
But if you want to talk about, psychedelic, even cocaine or drug or alcohol, all these things, they actually induce your body, your brain into a certain stage very similar to when you get into advanced meditative stage. So people doing all those things are just looking for shortcuts to achieve that state. But that stage, if you use these substances, you actually cannot sustain that stage, and you cannot get into that stage by yourself. So that's why if you try to do it the right way, then you should practice meditation. But it is very difficult and it takes time. And I think for some people have the inherent capability born with that. So I feel I have some of that. I don't know how much higher level I can go because I have now pushed to practice more. But I do know, because I also practiced Tai Chi for a long time in the past, and I do know I have stronger sensations about the Qi flow, energy flow in my body. Because even right now when I'm talking to you about it right now, I can feel the tingling in my palm. Because once we start talking about this, then I can feel the energy.
Yeah. Yeah, it hears you. It wakes up. It's like, okay, let's go.
Yeah. Another topic, we can do another show about.
Yeah, I mean, we could do an entire show on Qi meditation.
Yeah, exactly.
Yeah, you're coming back. But the focus of today is more about your practice and healthy aging, root cause. So you operated your holistic clinic in Boston since, I think, 2004, so over 20 years. What did you see that repeatedly came up from patients coming into the clinic, or a patient pattern that fundamentally changed how you think and how you needed to change the way that you deliver medicine?
So when I started my holistic clinic, my primary goal at that time was already set as trying to educate people about early prevention. That was the main principle, one of the 6 principles in my book, the 6 principles to natural longevity. So I always wanted to educate people and then tell them, you do not want to wait until the symptoms already start to treat anything. You need to recognize your body's predisposition, the imbalance before even any severe symptoms, or sometimes you don't even have any symptoms. But then you need to recognize your body's constitution. That's another principle among the 6 principles I talked about in the book. Once I started running my clinic and seeing patients every day, even like up till now, it's been 22 years, I still feel People just don't get that early prevention
Yes,
concept.
they don't. I know. I agree. We all know, okay, I need to sleep well, I need to move my body, I need to eat well, and I need to have a purpose, and I need to be in a social community, and be connected to my higher self. But we don't, we just don't want to do it. Like
Yeah,
what
so
is it deeply inside of us that's stopping us?
I think it's because here's a quote saying, change only happens if the pain of staying status quo is bigger than the pain of making the change. So if you want to do early prevention, you have to make changes. And then people just have so much inertia to make those changes because they feel, first of all, they feel if I need to make these changes, I'm losing, say, enjoyment in my life or some kind of pleasure I enjoy. So they don't want to make that change. And then if they really try to make the change, sometimes they cannot last. They just cannot persist on that change because there are so many other things in life that distract them. Then also, I think the basic fundamental issue most people have is that they still have this deep belief in Western medicine. They think, I don't need to take care of myself now. I don't need to pay attention to my diet or sleep or lifestyle to make any changes because if anything happens, I will be able to go to my doctor and my doctor can give me a pill or do some kind of surgery to fix it. And I think that's the other reason why so many people don't want to make changes.
I think there is a deep belief that the Western medical system has it figured out. And it's like, oh, yeah, when something bad happens to me, I'll just go and get it fixed. And in a lot of senses, Western medicine is very advanced in these things. In more of a plumbing sense, like we're very good at like the plumbing of the body. Yes. We're not so good at the mental and the brain health of the body. And then you do run into things that are just irreversible if you ignore them for too long. And then this is where I think we see Western medicine failing in a lot of regards.
So the problem I've run into, even now, I'm still trying to teach people about the concept of early prevention. Because it is so obvious that you don't want to wait until the war has already started to forge the weapon or the fire already starts. Then now you think, oh, I need to dig the well to put out the fire. Isn't it a little bit too late? All these things I've been talking for the past 22 years. And I feel the majority of the population I'm seeing, the majority of the patients coming to me, even now when they look for stem cell treatment, they're already very late in the stage, most of them. I mean, there's a very small percentage of people that are more into early prevention now, but most of them, 90% of them, they've already tried so many different things and then they failed. And then they start thinking, oh, maybe I should do something different.
I know it's always when it's too late. They're losing their mobility or they're losing their ability to just live life to the full joy that they were before. And unfortunately, we need to be doing these things now with that long-term mindset in mind, which is so difficult for people to, we want immediate reward. We don't want, exactly. Oh, I'm going to be healthy when I'm 80, which is a long time from now.
And some people even argue with me saying, oh, why do I want to live 80 and then I don't even enjoy life, like enjoy eating what I like eating. And then, what's the point?
But they could if they started now. I know. I mean, we're aligned. So when people come to you for stem cell therapies, this is what you do at your retreats. Am I correct? Yes. This is like your, just to make sure I'm saying it right, it's the Zenergy Retreat Center, right?
Yes.
I think that's very clever, the way that you put chi in there. So this is in Colombia. Can you tell me a bit about why you founded it there? Was it that the regulatory environment's the main driver? Just easier, Is it easy for the clients to access things this way?
So when I went to Colombia in 2017, before that, I never even had an idea thinking I wanted to go to Colombia. I went there because of a group of investors. They say they wanted to do agriculture investment growing coconut trees in Colombia. So then they organized this trip. So I went. And then after that, I fell in love with the place. And I actually went to 5 different places in Colombia, but then I particularly like Medellin area. And I feel the air is so fresh. The energy makes my body feel lifted. So I think, we already talked about a little bit earlier that I'm really into energy and feeling the sensation of the energy flowing in my body. So somehow when I'm in Colombia, in that area, I feel my energy is lifted. So that gave me the idea, okay, I wanted to buy a place there so that I can also set up a retreat and then people can come here to experience what I experience. That's how I started. So at that time, I wasn't doing stem cell treatment. I basically just felt the energy there is very uplifting for people to heal, to rejuvenate their body. So then around 2020, I came across this lab. I was introduced into that lab by chance about they were growing stem cells from umbilical cord. So that's when I started learning about stem cells. And then I felt stem cell treatment actually incorporate the principles we talked about in the book, the 6 principles, to help people heal faster, have healthier, longer life, giving their body a jump start to have better regeneration capability. So that's when I started combining the two together, because I think people can come to Colombia because of the regulation in the US that you can now apply lab expanded umbilical cord stem cells in clinical applications. So you can get these type of cells administered to you outside of the US, including Mexico, Costa Rica, Colombia. Oh, that's a very good combination since I want to promote people's healing, rejuvenation, regeneration. So this is a great combination. So that's how I started doing that at Zenergy.
So let's talk a little bit about stem cells directly. And for my audience, there's a very general audience. So let's take it down a scientific level. What do stem cells do? What are they doing at the biological level? How do they contribute to regeneration and longevity?
So since you are a PhD in pharmaceuticals, so I think you understand these better.
Yes.
But
I have a base knowledge, but it's always good to have a refresher too.
So a lot of people I talk to, they do now know there are actually 4 different types of stem cells. Everybody, when they think about stem cell, they think about embryonic stem cell. Yeah. But embryonic stem cell actually is only one of the 4, and that actually we never use embryonic stem cells to treat any condition because they are pluripotent and they can grow into anything, including tumors and cancer. You don't want to use that. Plus, embryonic stem cells, it's unethical to use that because you have to destroy the embryo to get them. So we never use embryonic stem cells because even yesterday when I talked to somebody else, she even mentioned embryonic stem cell. I said, no, we're not using embryonic stem cells. So what we use in our treatment is called mesenchymal stem cells. So mesenchymal stem cells can be in the umbilical cord, in your bone marrow, and in your fatty tissue. So the umbilical cord stem cells are 0 age. They are just from the birth, from healthy baby. And most times the hospitals, if people don't choose to freeze their own baby's umbilical cord in the cord bank, then basically it's medical waste. So that's when people start thinking, oh, we can, collect the umbilical cord and then get the mesenchymal stem cells. And these cells, they are multipotent. They are not pluripotent. So that means they can actually only grow into certain lineage of cells, like bone, cartilage, neural. Some people say they can grow into some neurons and then skin cells. So they have limited lineage of tissues they can grow into, so they will not grow into tumor. So that's the difference between this type of stem cells we use in the treatment versus embryonic stem cells, or even the other type is called induced pluripotent stem cells. So then the third one is called hematopoietic stem cells. They're in the bone marrow and they're only generating the cells for your blood, for white blood cells, lymph cells. So these type of hematopoietic stem cells, they actually are only used in treatment for leukemia, lymphoma, these type of conditions. So these type of treatment using hematopoietic stem cells actually are approved by FDA in the United States. But hematopoietic stem cells sometimes can also develop into tumor. So that's the other difference between hematopoietic stem cells versus the mesenchymal stem cells we use in our treatment. And then the first type is the induced pluripotent stem. That's actually induced in the lab. And that is what the pharmaceutical companies are more interested in, because they can induce these cells. They can take a piece of skin from you and induce them to become stem cells again. And then that they can use to treat epilepsy or some other genetic conditions, because they can induce the cells and they can manipulate that. So all these induced pluripotent stem cells are in the research stage. Any clinical treatment, none of them are available right now.
So what conditions are you treating with mesenchymal stem cells in your practice?
So most people right now, if they look for stem cell treatment themselves, a lot of them have joint issues. And mesenchymal stem cells do have very superior clinical effects on any type of joint condition, ligament, tendon injuries, or any chronic inflammation in the joints. So when people have mesenchymal stem cells in their knee joint, shoulder joint, hip joint, it actually can give them very fast relief from the pain that they've been suffering from the chronic inflammation due to the joint problem. And in a lot of cases, I believe if you do it early enough, that goes to the early prevention again about the joint. You don't want to wait until it's already worn out. You have to have joint replacement to do the stem cell treatment. However, when you're at that stage, if you do stem cells, it can still make your joint feel better without the stem cell, without the joint replacement. However, that for some people it may be a little bit too late. So if you do the treatment early enough, like my own example, I'm actually 50 and I've had some knee problem. I had multiple injuries in my left knee since 12 years ago, and I've been treating since I started doing the stem cell treatment 5 years ago. About 3 years ago, I started treating my own knee. I did 3 treatments in 1 year because I had complete ACL tear, but I never had any surgery. And then after that, I feel my knee is much stable when I try to do things, and I don't feel the minor pain I was feeling. But I was doing it at a very early stage because I didn't have osteoarthritis. I didn't have a lot of issues yet. I don't have a lot of knee pain. So after 3 years since then, I started feeling a tiny bit of pain in my knee when I was going up the ladder to fix something. So that's when I did another injection on myself. So now it's been about 6 months since my touch-up injection or another follow-up injection. So I'm feeling very good, and I've been doing a lot of hiking, and I'm planning to hike Kilimanjaro this year if possible.
I wish you luck with that journey. For people that, okay, if you're not feeling any joint pain at the moment, when can you recognize that I should start taking preventative measures? Is it something that we should think about with our age, or that if we're very active and we're runners, that it's maybe something we should be more aware of thinking about the preventative care when it comes to stem cells for joint therapy?
So if you are very active, you're athletes, you don't have any joint problem right now, actually for anybody like that, the good idea, if you really want to do early prevention, then you really want to do some intravenous infusion of stem cells, because that actually takes care of your whole body's inflammation. So when we age, our body accumulates more inflammation, because one of the hallmarks of aging is stem cell exhaustion. So when your stem cells cannot divide fast enough because the decline in the capability of proliferation from age 60 versus when you were born is 400,000 times decline. So that is huge amount of decline in the regeneration ability, because our body needs constant regeneration, and all this regeneration is done from the stem cells inside our own body. So they need to constantly regenerate new tissue, new bone, new muscle to replace the aged one that has to be cleared out of your body. So if the regeneration cannot keep up with your daily activity of wear and tear, then that's when the deficit starts accumulating. So that's why when people age, they would accumulate more chronic inflammation, because your body's regeneration cannot keep up with your daily activity, even though you are not an athlete. So if you are very active, you don't have any severe injury or any pain, and you want to do things early, then the best thing is to have some regular infusion, IV infusion of either stem cells or exosomes or both. So I have been doing that myself since 4 years ago. I've done infusion on myself maybe around 20 times.
How often would you recommend that somebody who wants to take an early preventative approach do these stem cell infusions?
Not everybody needs stem cells. And of course, I don't think it hurts anybody, even if you say, I'm very healthy, I don't have anything, I just want to do it for anti-aging purpose. Actually, that's mainly what I'm doing. And I think the best way to assess what is the best way for you to prolong your vitality, your longevity, your health span is to actually do a personal analysis. So everybody's different. You cannot, that's why you were involved in epigenetics, so you know everybody's different. So you need to assess each person's body individually. You cannot just say, okay, let's just do one intravenous IV of stem cell once a year for everybody. That's not how it works. We actually need to look at, so that part actually combines the traditional Chinese medicine approach. So we need to look at each person's body and look at their constitutional weakness and excess from their birth. Because I know what my body is born like, and I know my weakness. So I'm trying to address my weakness and also strengthen the weakness. And then I need to moderate the excess in my body. So that's how you can keep your body in balance. So during that process, you may need to modify some lifestyle things that you don't want to keep doing it to weaken your already weak system in your body. And then you also want to do things that can moderate the excess so that you can keep the balance, the yin-yang balance. And then also you can also utilize certain supplements and different things.
Can you measure before you do any interventions the stem cell count that somebody has?
That is very difficult too, because I think, have you ever heard of the stem regen, the supplement that they use? Actually, they use 3 different herbs. One is blue-green algae from Klamath in Oregon, and then the Madagascar aloe, and then the third ingredient is Tibetan sea buckhorn fruit. So he found out these 3 ingredients, when you take them, even in animal study or in human study, you measure the circulating stem cells in the person's blood or the animal's blood after you give the subjects these ingredients, then there's maybe 1,000-time increase in the release from the bone marrow to the bloodstream, your own body stem cells. So I guess if you really want to measure the amount of stem cells, right now the only measurement is to measure your circulating stem cells in the bloodstream. So it's a very expensive and also very tedious experiment if you really want to do that.
That's very true. I mean, I think there is quite an incentive if you know as you age that you're having 1,000x decrease of your stem cells over time, that it would be, I guess it's a very good biological age marker.
But there is research that was done comparing the 60-year-old stem cell versus the umbilical cord stem cells. That's where that number comes from. There is a research paper that was done within the past, I would say 10 or 15 years. So I can find that paper for you.
Yeah,
they
sure.
do show.
I'll have a look. We can link it in the show notes.
Exactly. So there is a research about that, but that was done inside the lab. So what they do is they extract the umbilical cord stem cells from the umbilical cord, the mesenchymal stem cell. Then they extract the mesenchymal stem cells from, say, 60-year-old bone marrow. Then they grow in the lab and then they test certain markers to see how active they are. That's how they come to that conclusion that it's 400,000 time decrease.
I know that there is a lot of skepticism amongst a variety of physicians about stem cells in general. And I'm
Yes.
sure you have probably faced a lot of objection to stem cell therapy and administering stem cell therapy. What's the most serious objection that you've had to face?
I think the most serious objection is people will say this is not FDA approved. So I'm not doing anything that's not FDA approved. And for physicians, they will say, since it's not approved, there isn't a lot of study about it. So then they would, if their patients are asking them, then they would say, well, it's not proven, so it's all experimental. I would recommend you just do steroid injection or take the immunosuppressive drug for autoimmune conditions instead. Why do you want to do the experimental treatment? So basically, for anybody who decide to do any stem cell treatment, they're making their own decisions. Because most of them, if they go to their physicians or go to their friends who are physicians, then a lot of them, sometimes they get discouraged because they hear from what other people tell them. Then they say, okay, maybe I shouldn't do it.
It makes it also, more difficult to find. If it's FDA approved, you're going to be able to find these things more easily with just probably through your GP or a specialist. But when you're operating outside of that regulatory space in jurisdictions that allow it, it does create some friction. And so how do you know that a clinic is reputable, that they have high quality mesenchymal stem cells or whatever exosomes or whatever they're using? What are the practices and protocols that you follow to ensure that you're giving the best quality products to your patient?
When I first introduced into this lab in Colombia, of course, I didn't know how good quality their stem cells are, so I had to test them. So number one, I tested under microscope. I even compared their stem cells versus the stem cells from a US company in Florida that they do sell the cryopreserved stem cells. So I compared them parallel. And I want to see under microscope how well they look. And also I stained them with trypan blue to see the viability. So ever since then, it's been 5 years. So I actually evolved. I have been using automatic cell counter to check the viability of the cells. So it's very objective, no subjective misrepresentation. And also you can see it right away. And I show people before their treatment, right before we administer the stem cells, I will put it into the automatic cell counter to show them. And then from this particular lab in Colombia, we also have certificate. And they run very thorough tests on all the batches of their stem cells. And because they can grow the stem cells in the lab, and the cells actually are vigorously tested. Plus, they only need 1 or 2 donors for the past 5 years. They do not need more than 10 donors to supply their stem cell. And what I found out was from one umbilical cord, the maximum number of stem cell, mesenchymal stem cells you can get from one umbilical cord is only around 25 million. Sometimes it can be even less. So in our treatment, since we use mostly 100 million cells for intravenous infusion for an adult, and then for one joint injection, we usually use 50 million cells. So that means you have to get multiple donors if you do not expand the cells in the lab. So then for this one treatment, you have to use 4 or 5 donors. So that's when it's very difficult to do the quality control, because are you able to test every single batch from every single donor? I highly doubt it. So that's why I do not use any stem cells supplied from US companies, because they cannot expand them. So they just simply sell you after they extract from the umbilical cord. So it's very difficult to guarantee that every single batch from every single umbilical cord is rigorously tested. If you get the stem cells from this lab in Colombia, it's actually much better quality, more rigorously tested, so it has guarantee of doesn't have any contamination. And even when they choose the donor, because they only need 1 or 2 donors, so they test these donors, the parents of the baby, rigorously for any genetic conditions too.
For somebody that's looking for a clinic to try a stem cell therapy, what would be a major red flag? You just said a lot of green flags in terms of the testing, but when do they need to run for the hills?
The red flag, sometimes you have to see whether the clinic is only for profit or are they really trying to help you.
Okay.
Just to
how can they tell?
Give you a story of, most recently, I've been talking to a gentleman in Maryland, and he was recently diagnosed with idiopathic pulmonary fibrosis. And he still doesn't know what's the reason why he got the fibrosis. And it only started about a year and a half ago. And before that, he said he has been living very healthy lifestyle. It sounds to me like he's relatively, doesn't take any medication, relatively healthy. So he called me, and then also he talked to some clinics in Mexico. He even talked to somebody in the US. So he has been doing his own extensive research. So what I found out during the process when I was talking to him, that first of all, I think you also need to have a connection with whoever you're talking to. But I do know I'm not a big operation in stem cells, and I do not want to become a big conglomerate offering stem cell treatment, because I think it's very important for the personalized treatment, and you need to have the connection with the people. And when people choose something that's not approved by FDA, and then they make their own decisions for their own health, they need to have assurance that they are dealing with a practitioner who really have the passion or compassion for their health, right? So for me, I really want to combine the 6 principles in my book with the stem cell treatment and trying to educate people about early prevention, about treating the root cause, and about how to address your conditions holistically, not just with stem cells. It's not like stem cell is a magic bullet. You have to combine the stem cell treatment with all the other treatments, approaches that's suitable to your body to make the stem cell treatment work well. So I never tell people, okay, you just do this one treatment, then you're all set. So he actually talked to a clinic in Mexico. They told him he only needs to go there for 6 days, have one treatment, and after that, he's all set.
Okay, I could see the red flag waving on that one.
And actually, over all this course, I've been talking to him since December. So he actually, and I'm not really trying to push him to make the sale because that's not my motive. My motive is to help people realize, oh, I need to follow these 6 principles for my health and longevity. And then if I need to incorporate stem cells and I have the financial ability and I want to do it, okay, go ahead, right? So then I can do it for you. But I'm also trying to educate people about, what you need to do to have better health outcome. A lot of big clinics, you actually don't even have chance of talking to any practitioners who are going to administer the treatment for you. You're just talking to like some patient advocates or all these other people. Like I have people telling me they try to call some other big clinics, like from Joe Rogan's show or something, and then they were never even giving any explanations or any assessment. So like for me, when anybody contact me directly, I actually will do a complimentary assessment first right now. I'm not even charging anybody, and you don't need to make any commitment to do any treatment. I'm just trying to tell you my assessment based on what you tell me, your health history.
So tell me a bit about the book. Your book is called The Regeneration Effect, Sacred Wisdom for Staying Young. Who did you originally write it for?
So I developed this idea of writing the book after I started doing stem cell treatment. And after I started talking to people and finding out that some people looking for stem cells, they're just looking for magic bullet that doesn't exist.
Everybody is looking for a magic bullet. They want to keep living their life exactly as it is and have the stem cells, and then everything will be fine.
Even people are not looking for magic bullets. They don't have the understanding that for your body to work well, you need many different approaches combined together. And then stem cell treatment is only the jump starter. Like when you jump start the car, the battery is dead, you jump start it, and then if your alternator is not working, then the car is going to die again, right? But if you jumpstart your body with the stem cell treatment, and then you do other things to fix all the other problems that's causing what you're experiencing in your whole body, then that's when you can make the stem cell work really effectively and also work for a long period of time for your body. So that's when I realized, I need to summarize all these things from my experience in traditional Chinese medicine, from my family, plus what I have seen in my stem cell treatment in the past 5 years to educate people. And that's a way for people to understand the difference between my treatment versus or any other clinics they go to. So that's my primary goal of trying to educate people. And like we already talked in the beginning, even though I've been trying to educate people about early prevention for the past 25 years, people still don't get it. So I really want people to learn about it and repeat, to read the book. And then the book will have a lot of illustrations in the hardbound copy. So it's also a very beautiful book you can put on the coffee table, and then maybe you can just flip through it when you're relaxing, thinking, oh, maybe I should do the early prevention for me.
I mean, I think the more exposure we have to these things, the better. And even with the way that the longevity field is developing, longevity in its core is preventative medicine. It's early prevention, early detection. It's now just wrapped up in this sexier word called longevity. And we're all subscribing to that now, which if that's how it's going to get across to people, I'm okay with it. But, we're both here to educate and show people that we have these different interventions, but also at the core, you have to really get your pillars of longevity, your non-negotiables solid first. So talk me through, you have 6 principles in the book. Can you just quickly go through them?
Sure. The first one is recognize your body's constitution. So that one can be done with any experienced practitioner, even including some functional medicine practitioners. But I also look at not just from the Western functional medicine perspective, but also from traditional Chinese medicine perspective, so we can recognize even earlier imbalance signs in your body. And then the second principle is early prevention. As early as possible, that's the best time. But if you feel, I didn't plant the tree 20 years ago, but then if you start planting the tree now, that's the best time. So the third principle would be treat the root cause of the problem. So once you recognize your body's constitution and then you try to do the early prevention, you have to treat the root cause, not the symptoms. So like this gentleman with fibrosis, you don't want just to ask him to take the antifibrotic medication, because what is the root cause? And he's been to so many specialists in Johns Hopkins, and then they didn't tell him what is his root cause. They just tell him, you have fibrosis, then we think you only need to take this antifibrotic medication and you only have 2 to 5 years to live. And he doesn't get any other answer. And so we need to treat the root cause. And then we need to look at the body as a garden, not like a machine. It's not like you can just switch out the knee joint, the shoulder joint, then your body is fixed. Because our body is a garden, everything is interconnected. Sometimes when you have, say, digestive system issues, it's not because your digestion, your stomach is bad. It's only because you're having other issues inside your body that's blocking the signal to the digestive system. That's why your digestive system is not working properly. So in Western medicine, most times they just treat this part. Okay, you have knee problem, let's replace it. You have stomach issue, then let's just give you the acid reflux medication or these things to fix it. So they don't really look at what's the underlying cause and how to address the whole connection between different parts of the body. So that's the fourth. And then the fifth is like you want your body to follow the natural rhythm. So you have to adjust your body to the season, to the time, to different years. Then your body needs to be in harmony with the nature, the universal energy. And that's when you can have the most optimized health because our body needs the energy from the universe to have better energy flow. So that's more metaphysical part, but the simple analogy would be you don't want to swim against the current. So when you realize, okay, that actually applies not to just to health, actually to everything in life. If you realize, okay, this is not a good time to do upstream swimming because the current is too strong. If I do that, I'm going to strain my energy and I may be killed in the strong current. Then don't do that. That's a common sense. So you need to wait for a better time when the current is not too strong and you have better strategy to go upstream, right? So that's the analogy. So you need to follow the natural flow. And then the last one is when you combine all the holistic approaches, particular design to your body's type in the right proportion, that's when you get the most benefits and the optimized health and longevity.
They're beautiful principles, and I definitely can see how it takes a bit of trial and error as well to go through this. You know, you have like, there's a bit of testing, there's a bit of experimentation, and like you mentioned, going with the flow, finding out what works best for your body versus someone else's body, because, you know, we read things online and we think, oh, the workout for me right now is hot Pilates or whatever it is. And then you go do hot Pilates and then you're like fainting inside this heated room. And it's like, but everyone's doing this and everyone looks so great. I want to be able to do it. And then you kind of force yourself into this mold that maybe isn't right for you when your body would be better just out running or swimming.
Or even you look at the longevity community or people who want to biohack, some of them, they only follow the trends. They only follow what other people are doing. But in reality, each person is different. It works for somebody else, it may not work for you, right? A perfect example is everybody says red light is good for you. Yes, I do know that. And that I do that myself too. But I found out for my particular body, I cannot do the red light therapy at night. It disrupts my circadian rhythm. And then most people don't tell you that. And then most people, they just follow whatever other people are saying, or the influencers on the social media are saying. They just say, oh, if that works for them, I'll do that. And then they don't really do it persistently. That's the other thing. Anytime you find out the right thing that's right for your body, and then you do it in the right proportion, you actually want to do it persistently for the long term. And for most things, you have to do it persistently for it to take effect, for it to be having longer lasting effect on your body.
So, Dr. Yi, I have a couple rapid fire questions for you. So the first one is, what is the one free daily habit with the strongest advice for longevity?
The best longevity advice would be having good amount of sleep for your body. So for me, I actually don't need 8 hours sleep. I cannot stay in bed for 8 hours, but I feel very energetic as long as I have enough deep sleep and REM sleep. So what I really try to achieve is to have the best length of deep sleep for my body to recover and regenerate. So that again goes to everybody's different.
Optimized sleep.
Yes.
What is the most overhyped longevity intervention that you'd like people to stop talking about?
Taking rapamycin or metformin, I think that's very bad for people. Even though like some people, they say, oh, it really works for the biohacking or do only small doses. And you look at Brian Johnson or some other people who have been trying rapamycin in very small doses, low doses, they would still get prone to infections. And Brian Johnson himself actually stopped doing it after tweaking for 5 years. So I think any pharmaceutical things that you're trying to use, again, your body is a garden. You cannot just use one pharmaceutical ingredient, even though it showed that prolonged the longevity for the worm or the mice. I don't think human being is set up to rely on one pharmaceutical to prolong the life.
What is the biggest myth about stem cell therapy that you wish the media would stop repeating?
A lot of times people say, I heard stem cells can cause cancer. But you have to look at, we talked about there is 3 different types of stem cells from your body. And 2 of them can cause cancer. And then the one mesenchymal stem cells, they're non-tumorigenic. So there were 3 cases, reported cases, about people getting stem cell treatment and then in their joint or in the spine, and 3 years later they got some tumor in their knee or in the spine area, and they tested the tumor. They found out that actually came from the stem cell they used in the treatment. And those 3 cases, all of them, they were getting the stem cells from the bone marrow. So if they get it from the bone marrow, sometimes it can be contaminated with hematopoietic stem cells. So that's when, like I said, hematopoietic stem cells sometimes can cause cancer. So that's why you need to have very pure, isolated mesenchymal stem cells without any contamination. So that's also very important.
My last quick rapid fire question for you is, what's one thing that traditional Chinese medicine gets right that Western medicine still hasn't absorbed?
Early prevention. Because Western medicine is set up to treat the symptoms, and they will only deal with the symptoms when they arise, right? So one good example would be the shoulder. A lot of people, when they get minor shoulder pain, and then they think, oh, this is just minor strain, I don't need to do anything, and I just do a little bit of stretches, it will get better. But when you are in your 40s, 50s, and beyond, if you get shoulder pain, that's a very early sign that you need to address it, because most people, if you ignore it, it can develop into frozen shoulder, or even you have to do the shoulder surgery to repair it. So never ignore early signs of shoulder pain if you're in their 40s and beyond. And if you injure your shoulder in your 20s and 30s, you also need to treat it early so that you don't want to develop into other shoulder problems later in your age.
Dr. Yi Song, it's been so lovely chatting with you and you sharing your wisdom with me today. Where can listeners find you and your book and your clinic and your retreat center?
For your listeners, I want to offer them a free download for one of the principal book pamphlet. So you can go to gift.regenerationeffect.com to get Tend Your Body Like a Garden free download ebook.
Cool. I'll also drop that in the show notes.
And if you want to order the the hardbound copy that's coming out in a few months, we also have book.regenerationeffect.com that you can do that pre-order. If you only look for the stem cell treatment part, go to stemcelltherapyexperts.com. And you can also check my podcast about stem cell exclusively on YouTube, Stem Cell Therapy Experts. You're just putting that in YouTube and it will come up. And also you can find my other Regeneration Effect podcasts, and they're all on Apple Podcasts everywhere. So.
Well, thank you so much, Dr. Yi Song, for joining me today. It's been a really interesting conversation. We will have you back to talk about all the metaphysical. We're talking about energy flow and meditation, and I would love to dive into mental health and wellness with you.
Yeah, I'm so looking forward to talking to you again.
So thank you again.
Yeah, thank you so much.